Dentistry and General Radio Network presents The Bald Truth, the Dental Politics Podcast with Dr. Bob D. and Dr. Spencer Bloom, Special Edition. In this episode,
there are people, Kerri, who are telling me, but come on, Bob, one day test, someone may have a bad day and not be able to perform the way they're supposed to. What's your answer to that?
Everybody has a bad day, but if you're having a bad day in the practice and you accidentally extract the wrong tooth, or you damage the tooth next to the tooth you're supposed to be working on, that's a problem. We're all entitled to bad days. We all make mistakes. We're all humans. If you had a bad day, you made a mistake, then you'll be fine the next time. And if you're not fine the next time, then that's the problem. That's what we're trying to catch and correct. Those are the people that should not be working on the public.
Dr. Bob D. interviews Kerri Friel, RDH, regarding the two interstate license portability compacts for dentists and hygienists.
Hello, everyone. I'm here today with Kerri Friel. I met Kerri through a friend because I was looking for a hygienist to speak on this important issue that many of you heard me talk about, maybe sick of it even, for the past 3 months. And that's the Interstate License Portability Compact. For those who are listening and don't know what a compact is, it's basically an agreement between states to reduce red tape. So if you are a barber and you want to get up and go from Illinois to Iowa, you don't have to go through all the paperwork. You can just go there. I use that trade on purpose because we're going to talk about that. Kerri was introduced to me as a hygienist and as an educator, and I want to talk to her about what her opinion is. For transparency reasons, Kerri and I appear to have the same point of view. So I am allowing the same time for the other side to come and talk to me. If you'd like to come on my show and discuss your point of view, I will be happy to interview you. Kerri, would you please take a moment to tell me who you are first and what you do?
My name is Kerri Friel. I'm a professor in the dental hygiene program at the Community College of Rhode Island. And I've been educating and training dental hygienists. And we also have an accredited dental assisting program for just about 25 years now. And just full disclosure, I am also an examiner with CWC, CDCA, REB, CETA. So I think I have a unique perspective on just seeing students from different schools, different areas of the country.
Let me bring something up, the elephant in the room. When American Dental Association and the Hygiene Association bring up the compact issue, they want people who have already taken a test not to be retested. And when we bring up this other compact that Kerri and I believe in, they right away say that the people who are for it, Kerri, they say you are trying to protect your jobs as examiners. In other words, as an examiner, you are making millions. And I say that because I know most people who are examiners do it because they want to give back. You barely pay your own expenses. I'm sure you lose money going to examine students. I want you to tell me, and I've already talked to Dr. Guy Champagne about this, but I want to hear it from the hygienist point of view. Kerri, why are you an examiner?
I have been involved with this organization since I was on my state dental board. I started in 2013. I did 2 3-year terms. And when I was appointed to the state dental board, I didn't even realize that this was part of my responsibility of being on the board. So just by being on the board, you're invited to join this organization. So it was like, wow, what is this? I had literally no idea and hadn't really thought about it since I was a student and I took my boards back in the early 90s. So I got involved with the organization and I started doing different dental exams. Not a lot. I had young children at the time. But it really, truly is a sense of you are giving back and you're helping the organization to make sure. And the bottom line to me, and something I had never put 2 and 2 together, but by being on the state dental board, your main mission is to protect the public. By being one of these examiners, you are also charged with protecting the public. A hand skill exam, I believe, and I'm speaking on my behalf, I'm not representing any other organization, I'm not representing the school I work for. This is how I feel. I think that is truly the only thing because it acts as a stopgate for people that aren't ready to practice on live patients. There's a dental hygiene OSCE being developed right now, and it's due to be released soon by the Joint Commission. That's not going to gauge whether you can feel calculus or not. So, an example, on this exam, you might have a radiograph and the question will say, can you please identify where the calculus is? Which is fantastic when you have a radiograph, but you don't always have a radiograph when you're cleaning a patient's teeth or performing scaling and root planing. So that's just one example of, yes, I can see where the calculus is, but if I can't remove that calculus, then what good is it identifying it on a radiograph?
Yeah,
So,
and I want to explain this, what an OSCE is, because dentists like myself, we're the old crowd. We took the NERBs, we took different hand skill testing, and first of all, the live patient, I use that word with Dr. Champagne and goes, what, are there dead patients? The patient exams are the thing of the past, right? Right now, we can have these mannequins that are very well made, at least for dentistry, and I don't know anything about hygiene, that are ethical to work on. So there is no excuse that says patient exams we should maybe call it live exam on patients are maybe not ethical, but we have mannequins now. And 49 out of 51 territories, I think, accept this one test that has a live exam on patients. The OSCEs are tests being developed that they evaluate the comprehensive education of a student, treatment planning, thought process, everything else. They're great. As a matter of fact, I think ADEX does have an OSCE as part of the exam. The problem is if you are going to pass a compact that says you can take any test, regardless of a hand skill test, then that's where we have a problem. The OSCEs are great. You want to use the DL OSCE, which is developed by the ADA, by the for-profit arm of the American Dental Association. You are more than welcome to use it and combine it with something else. But the issue here is the hand skill testing. And I want to bring this up as well, because there are people, Kerri, who are telling me, but come on, Bob, 1-day test, someone may have a bad day and not be able to perform the way they're supposed to. What's your answer to that? But then I'm going to offer my answer.
Well, everybody has a bad day, but if you're having a bad day in the practice and you accidentally extract the wrong tooth, or you damage the tooth next to the tooth you're supposed to be working on, that's a problem. That's a problem. We're all entitled to bad days. We all make mistakes. We're all humans. But I think something that has been really eye-opening to me, and I'm not as familiar with the dental exams. I'm not a dentist. But the people that fail the exams, first of all, with dental hygiene, they don't always pass it. It's not 100% pass rate. So there are people who will not pass it. They'll take it again. They have to wait a minimum of 10 days. And then they'll not pass it again. And then they'll remediate and they'll not pass it again. That's a problem. That's not just one bad day. And the percentages, and I don't have the numbers off the top of my head, but if you don't pass it a second time, you're less likely to pass it a third time. So that's a little different than having one bad day. If you had a bad day, you made a mistake, then you'll be fine the next time. And if you're not fine the next time, then that's the problem. That's what we're trying to catch and correct. Those are the people that should not be working on the public. And for instance, at a dental hygiene exam I was at recently, there was a candidate there. It wasn't from the school, and that doesn't matter, but they were using the Cavitron. They didn't have any water on. And my handpiece is hot. And I make sure everything's working. Everything looks great. Kept turning the water off. It's something like that. Those are things we see out there. When I first started examining, it was my very first exam, I saw a Cavitron burn, this is back when we were a live patient, on a tongue that I had only seen in textbooks. It was on a live patient that was anesthetized, the Cavitron burn on that tongue. I'll never forget it.
Yeah.
What you had asked me why I do these exams, it's because of that. We have to do these exams. And nobody is participating in these exams to make money. I'm away from my family all weekend. I work 5 days a week and it's exhausting. We're up early. You do it because somebody has to do it.
Absolutely. And I know the percentages for dentistry. And I have YouTube interviews of Dr. Guy Champagne that explains it. I think a total of 2%, and that includes criminal activity, meaning those who have committed crimes that cannot be licensed, and those who do not have the hand skills to become part of a surgical discipline. Dentists are part of the surgical discipline. You have to have repetition for your muscle memory to know how to drill a tooth. You're literally drilling in someone's head, right? And if you have a bad day, you take it again. But what happens? You continue to fail. What do we do? How do we catch that? And if you consider less than 2% of 8,000 now dentists graduating, that is 160 dentists per year. And each dentist seeing 5,000 patient encounters per year, you're talking about a lot of patients that can be harmed. Hand skill testing, I don't think anybody should be against it. Again, they have these things that you can have residencies to replace that. I'm okay with that as well. I don't have a problem with that. But the OSCE, the difference between the OSCE and the other exams is basically the OSCE is a written exam. There is no hand skill testing. You need to combine it with something to be complete. Now, tell me about the fact that there are some hygienists, and the hygiene organization is for getting rid of the hand skill testing. What is behind that?
In, I believe it was July of 24, the ADHA, the American Dental Hygiene Association, they passed a resolution that supported the elimination of the hand skill exam. And my personal opinion with that is because it feeds right into the Dentist and Dental Hygiene Compact, the DDH. I had been a member of the ADHA for many years. Because of this resolution and because of the support of eliminating this hand skill exam, this is the first year. And as I said, I don't know exactly how many years that I did not renew my membership with ADHA this past January. And I was expecting somebody to call me and say, hey, you've been a member all these years. What happened? Nothing. Nobody misses me at the ADHA. I'm like, well, why is it even, not even in my own state? No one said, hey, why didn't you renew your membership? Nothing. But that is the reason.
Yeah.
Because I so firmly that we have to have a final check and balance, because I've seen what candidates do at these exams, mostly in hygiene, but I have worked the desk and I do some of the IT for dental exams. And that there has to be something else, because while all of the schools that are accredited by the Commission on Dental Education, while we all follow the same standards, we don't all have the same programs. We don't all have the same patient encounters. Some schools might not have a robust patient population. Some schools have a great patient population, and those students get a lot of experience. Some students rely a lot on mannequins initially because they don't have the patient population. So I think that's where the differences are. And then another thing that I mentioned, that worst Cavitron burn I've ever seen, that was at a private college. So I'm at a community college. If our students, if they're unsafe that first semester, we have documentation that supports what we've seen. And then if they're not successful in clinic, our administration supports us because we've been doing this for a very long time. But we're at a community college. Our tuition dollars are extremely low. Whereas if you're at a private college, the pressure to pass students, whether they're ready or not, is immense. From some of my colleagues that work in private colleges in neighboring states, they have a lot of pressure where they don't have the ability to not pass somebody who just can't do it, physically can't do it. You might all want to do it, but not everybody can be a dentist. Not everybody can be a hygienist. You have to have a good amount of hand-eye coordination, spatial recognition, and just because you want to be one doesn't mean you can't.
Yeah. And there's a small percentage. We're not going to sit here and says
Exactly.
20% fail, right? It's a very small percentage, but to throw the baby out with the bathwater to basically make sure everybody moves, my personal opinion is, Kerri, this is being pushed by private equity-backed organizations. I feel like this doesn't help private practices, right? We talked about rules coming in before we went on air, rules such as foreign trained dentists and dental students and assistants being able to do the job of a hygienist. Listen, I talk to a lot of dentists. If the economics and the shortages were not there, nobody's hiring anybody else but hygienists. We have good relationships with our hygienists. So shortages are an issue. Reimbursements are an issue. When you can't really pay someone $70 an hour, when calculating the cost and everything, you're losing $20 per hour. So I feel like this compact is not being pushed by dentists and hygienists. It's being pushed by private equity-backed organizations, and they prey on the emotions of dentists and hygienists because we all want to move just like the physicians and the nurses, right? Oh, why can't we move to Arizona? The truth of the matter is you can. With the ADB compact, all you have to do is apply for the license. You don't no longer need to take the test. And you just have to apply for a license rather than a permit, which barbers and cosmeticians and different trades have. Do not reduce our profession into a trade organization. What are your thoughts on that?
That's a good point. I worked hard, just like you did, to get your license, and I want to retain my license. And if I do something wrong, then my license should be taken away. With a permit, it's not the same as a license. It just is not the same. It's similar, but it's not the same. It's just really not something I would support and not something I would be interested in. If I'm going to have a license in the Northeast where I live, then I want to have a license in those states, not a permit to practice, because it's not, and it's also not going to be standardized. States that have lesser requirements, they're part of the compact, and they want to come and work in a state where I live, then I want to make sure that those people went through the same rigors, the same testing that I went through. So it has to be equalized somewhere.
I definitely have heard that there are some states that have, 6 continuing education per year requirement, where we have 16 per year here in Illinois. So what happens if someone with 6 continuing education requirement comes to Illinois? With the DDH compact, they don't have that requirement because they're not applying for a license. When you apply for a license, they're going to check your criminal background, your continuing education. There is a talking point that the DDH compact people say, yes, we have the criminal background check as well, but the wording is very important. They're not required to do it. They can do a criminal background check, but it's not required like the way it is requirement for a license. Is that the same way for hygienists?
Yeah, it is. It's the same language. And speaking of that, the commission that will govern and oversee, and I have not attended any of the meetings, and so I don't want to seem like I'm an expert talking about this, but from what I know by going to their website, the commission is made up of board administrators primarily, not necessarily dentists and dental hygienists. There's only a couple, I think maybe 1 or 2 dentists on the board. And that's also an issue. And that's where, as a hygienist, each state that joins this compact, they can choose 1 commissioner. So who is that commissioner going to be? If it is going to be a dentist or a dental hygienist, usually the boards of dentistry in the states, the dentists outnumber the hygienists.
Really?
So it would be highly unlikely that a hygienist would be elected to represent their own profession. And now it seems not even dentists are representing their profession or a hygienist profession on this commission. So who's making these decisions, like as far as continuing education? People that maybe don't have the background that they should.
Yeah, and the other interesting thing about the exam is that they say any exam.
Any exam.
Any exam. Tomorrow, the Department of Education that doesn't know anything about dentistry or hygienist is going to put out a test. that they have had ChatGPT write it. And now that exam can give a dentist and a hygienist a license. So there are a lot of issues here. And I am inviting both sides to get together and come up with something we can all live with. It is not going to be a compact if you have 1/3 of states taking one, 1/3 of states taking the other, and the other third says, heck with both of you guys, we're not going to take any. We're back into the same regional boards thing. If you want a real compact, you need to get together. That's the point. That's what I'm trying to bring together. And I believe most of the people on the other side also would care about patient safety because they argue it. We don't see it that way, but they also argue it. So they're good people. It's just that they're misinformed.
I know the DDH, they've been really strong with saying it's going to only be CODA accredited school. But the fine print in the language, it says CODA accredited or another institution accredited. I think it was the Department of Education.
Yep.
Why do they have that? Or maybe it's successful. I can't remember. It's been a little bit since I looked at it, but it's leaving that door open where another agency could come in. And I think once we ring this bell, we're not going to be able to take anything back, even when we solve the workforce shortage. And that's a whole other issue, the workforce shortage, because we have less people being born, less people graduating from high school, less people going on to school. I honestly think it's going to get worse for a few years before it gets better. So.
Yeah, you brought up CODA. I don't have that much confidence in CODA anyways. When I hear texts, these are my opinions, not Kerri's. When I get texts from students from major universities that they're graduating with doing 2 crowns and no root canals, and we're not going to have hand skill testing, how do you explain to patients the reputation of our professions? We're going to be losing credibility with patients. Did you know, Kerri, that there are talks to have these dental schools with no clinics and they will ship the students to DSOs for clinical training?
No, this is the first I'm hearing of that.
I'm hoping that's going to go away, but there are schools being opened that they're not planning to have any clinics. It's going to be tough times for our profession. I'm close to retirement, but I'm doing all of this to make sure there is a profession for the next generation.
I can only speak for dental hygiene, but we are fully competency-based for dental hygiene. So our students have to have patients. We have to have we have to guarantee so many patient experiences, and they have to be similar. So I'm not sure why dentistry might be different than hygiene. That I just don't know. What's not my realm. But that is really frightening.
Yeah. We also need to understand that because of the shortages, we may cross a line that we may not be able to go back. In other words, if you loosen up standards for dental hygienists, do I really want somebody giving anesthetic to my patients that have not gone through proper training and proper testing? The beauty of it for the hygienist is that my license is on the line as the owner of the practice. We still don't have independent hygiene practices in most of the states. So dentists should not be pushing for these laws. We should be pushing on trying to solve the problem of shortages of the dental hygiene. But hey, I want to thank you. I know you worked hard this weekend. You were testing students and woke up early. I want to thank you for being here today, and hopefully we can revisit this issue and have solved it by the time we meet next time.
Sounds good. Thank you very much for having me. It's been a pleasure.
Thank you.
This has been a production of Dentistry in General Radio Network. Visit our website, dentistryingeneral.com, to join engaging clinical and business conversations, explore our dental podcasts, and stay updated on our upcoming live events.